In honor of the 42 years that Meridian has served the community and in the spirit of social distancing, we bring our 2020 annual meeting to you virtually. This special virtual edition called 42 Minutes, sponsored by Genoa Healthcare, will feature our annual board meeting and award celebration. During this edition, you'll hear about our value to the community and accomplishments from the past year through the dedication of our staff and community. And we will also honor and celebrate community members and staff members.
Hello everyone, my name is Don Savoy. I'm the President and CEO of Meridian.
Deborah Gordon, Chairman of Meridian's Board of Directors.
Jeff Feller, Meridian board member, and your news anchor for this edition of 42 Minutes.
Depression can leave us with constant feelings of worry, sadness, and worthlessness. It takes away our interest in activities we used to love and find joy in. It causes us to feel so physically and mentally exhausted that even a simple task takes extreme effort. It can feel difficult to accept help when you feel you have no worth at all. But there is always help waiting when you are ready. And that's where we come in. We are here to help you take your life back and find joy again in the small moments. We are ready when you are.
Welcome back. Now for our next story, Deborah Gordon, Meridian's board chair, is on scene in our Gainesville boardroom. Deborah?
Thank you, Jeff. It's my honor to call this meeting to order. Thank you for tuning in to our special virtual edition of Meridian's annual meeting. This is an opportunity for us to share our annual report, celebrate our accomplishments, and share some of our new initiatives. Our agenda is to seat new officers, present awards, and review our past year. First, I'd like to recognize our board of directors. Members of our board are Susan Summers, Vice Chair, Tina Seifert, Secretary, Natasha Allen, Denise Bennett, and Jason Kaysen. Kendall Crummy, Jeff Feller, Patricia Knight, Stephanie McClendon, Paul Metz, Bob Milner, Irma Phillips Maxwell, Becky Sharp, Sonoma Brown, Emeritus. Next, I'd like to recognize our Board of Associates. This advancement advisory group helps to advocate for mental health and helps to secure resources for Meridian's mission. The members are Denise Bennett, Chair, Steve DeKuliak, Sam Guess, Kathy Ipser, Joel Islam, Kevin Marshall, Chad Paris, and Eric Parker. Now, I'd like to thank our nominating committee, Jeff Feller, Robert Milner, Irma Maxwell Phillips, and Stephanie McClendon for their service to this committee. I'm happy to present our board officers for the year 2021. I'm honored to virtually hand the chairmanship for next year to Dr. Susan Summers, Christina Seifert, Vice Chair, Jeff Feller, Secretary. These members accept their office as approved by the vote of the Board of Directors during our November meeting. We're excited to have these members serve during the upcoming year. On behalf of the Board of Directors and everyone watching, I'd like to thank you for your dedication. We would also like to welcome our newest members to the board. Jason Kasem, representing Levy County, and Denise Bennett, representing Alachua County.
Our 14-year-old son Dylan was having dark thoughts, depression, and anxiety. He was Baker acted due to suicidal thoughts and received help in the Children's Crisis Stabilization Unit. He was prescribed medication for his depression and subsequently began to open up about his feelings in therapy. He learned new coping and communication skills. He is doing better in school, and we have learned to trust him again, which means he is able to enjoy some free time with his friends. We are so grateful that Dylan cares about himself again.
In our next story, Don Savoy, Meridian's president and CEO, presents the annual report from his Gainesville office and recognizes the commitment of some special people. Over to you, Don.
Hello, everyone. I want to take you through several of our key initiatives that took place over this past fiscal year. We really have, despite COVID, an amazing year of growth and innovation. Even with the disruption, we were able to do some really amazing things. Our community impact has just been amazing, and our ability to really serve the folks that need us most through this really trying year is difficult. This is a transition year for Meridian as a whole. Meridian has had 3 CEOs, and I've taken over just in this past halfway through this year as the 3rd CEO. And doing so, we had a plan to move forward. And through the pandemic, we really needed to re-architect that plan. But I think we hit most of our goals. So one of the things that's really amazing is we were roughly 2 weeks out to 3 weeks out for treatment. And with the pandemic and really a growth in telehealth and other innovations, we were able to increase access to care and treatment really to same day, next day. And that's super important for folks. Many of the folks that we serve, although not technically a crisis, are perceived in crisis. And a delay to get them help really takes a toll on their lives and it really puts a pause. Our ability to move the same day, next day has made a marked difference in people's lives. And we did this during this trying time. You know, as we move forward, really in the first part of 2020, we did get into the pandemic, and you know, there was a lot of uncertainty we dealt with. But one of the things I think we're very proud of is that no employees were ever furloughed or laid off from Meridian. It was tenuous at times, but even through the pandemic, not only did we not furlough or lay folks off, but we continued to hire and hire at a faster rate because we had additional demand that we knew we had to meet for our communities. So one of the things that we really needed to do, and we found that this disruption to be somewhat transformative as an organization. We shifted and revamped service delivery. Access, we were able to implement safety protocols in order to keep our clients and staff safe. While we continue to provide essential health care. It's really important to note that while we continue to provide health care, we really did keep everyone safe, and we continue to do so. To date, we've not had a bloom of COVID on any of our inpatient units, either staff or clients, and that includes our residential, our recovery center, really the core of our acute care and residential programs, and also with outpatient. This has allowed us to continue on with the services we provide and increase during this process. Through the year, Meridian provided 23,332 client services. This is just about even the same we provided the prior year, but up through the first 9 months, we were on a trajectory to increase service delivery by 4.5%. What does that mean? It means that services did decline a little bit in April, May, and June, but we still were able to meet at least the demands we had prior, and since then we've continued to increase our service delivery. We were able to provide telehealth services to 9,608 clients through June 30th. That equates to 31,000 services. We couldn't have done this if we hadn't prepared prior, not only to the pandemic, but really to innovate, and we've been providing telehealth services for the last 5 years. That preparation, that plan, that growth gave us the ability to ramp that up to about 8,000 telehealth services a month for the last 3 months of the year. Meridian Acute Care Services increased by 8% from the previous year. We continue to see a higher demand for children's acute care services as well as adults. We work hard to keep folks in the community and manage from a community base, but having those resources here are absolutely critical. Meridian continues to innovate. It's part of who we are. We continue to grow over the years, but there's always more demand than we have capacity to handle. This year, we met a milestone. Even with everything else going on, we surpassed $50 million in revenues for the first time in the history of Meridian. We do see this as a milestone. We see this as a leapfrog, and we see this as an opportunity to grow. Because again, there's far more need out there than we have the demand currently to meet. So let's talk about some of the achievements. Despite the pandemic, we added our respite recovery services up in Lake City in October 2019. We converted our inpatient detox unit to a licensed addictions receiving facility in February of 2020. That's absolutely critical. It's allowed us now to hold Marchman acts in the community, really to keep folks safe when we otherwise weren't able to do so in the same manner. One innovative program that we put forward that we really didn't have a plan for was tablets. Thanks to several benefactors, we were able to purchase and get cellular service for several hundred tablets, which we deployed to homes and into the community. We did this because we knew that there were folks that were not able to get to treatment due to COVID and get out and to receive the services they need. From April, we went on and we deployed these tablets and really got folks the services to maintain and manage folks through the crisis. So another thing we did in May of 2000 is we expanded our medication-assisted treatment program to Levy County. We opened a clinic in Chiefland, and we did so really because of demand and need. Many of the folks in our medication-assisted treatment program were having to drive to Gainesville or to Lake City 2-3 times a week. And that is an undue burden for someone to receive care. So we went on and opened the clinic in Levy County, and we continue to move forward. We also got the addition of a $150,000 telehealth grant to serve those affected by COVID. We know that there's a lot more need out there since the pandemic. There's a lot of anxiety, depression, that we know that we need to work to manage. So we've used this grant to provide telehealth care and really some in-office services to really get people through this very trying time. So one of the things that we talked about at the last annual dinner was children's crisis stabilization and the need for additional beds in Alachua County. In June 2020, we opened up a Ted Bend unit here in Alachua County, which has been very much needed. It's been close to full since we opened it, but the key reason why we did it really was to serve folks in the community where they live, have greater access for family and caregivers to come in and be part of the treatment needs for those folks. And we're really excited that we've been able to do that and meet that need for the Alachua County, Gilchrist, Levy, and other local residents. Something we talked about really for several years at Meridian is really changing the way we provide access to care. We've stood up Meridian Care Connection in June of 2020. It allows for 24/7, 365 walk-in access for non-acute needs in Alachua. It's made a real difference in folks' lives. It's also allowed for more capacity. When you add in telehealth, you add in the ability for 24/7 access. It's given us the ability to more closely be attuned with folks' needs and demand. And now we're working to make this via telehealth available to really all the counties that we serve and really the entire state of Florida if needed. There's always challenges we face, but having some resiliency and really using technology and innovation to provide the care that's so critical has been a huge improvement in access for folks. Since 2018, Meridian has partnered with the City of Gainesville for a co-responder team. That's a community-based team with a mental health component and a law enforcement component to go out and reach folks in a crisis. They've done an absolute amazing job. The outcomes are better than we could have ever expected. And in June of 2020, we expanded this with a second team tied to the Alachua County Sheriff's Office. This has given us greater and broader reach, and we continue to seek more teams. I can tell you that right now we're in discussions to add additional teams because the value has been amazing. Over 80% of the folks that have been engaged with the team that could have been brought in under a Baker Act, we've been able to manage in the community, provide wraparound services, and really reduce their trauma as part of their effort. We also see the need to expand medication-assisted treatment out to the communities where folks live. We recently won a competitive bid to expand medication-assisted treatment to both Suwannee and Putnam counties. Why Suwannee and Putnam? We have medication-assisted treatment in Levy County, Columbia County, and Alachua County. The addition of Putnam and Suwannee counties give us greater reach, but really the key is more access to the folks that need us most. And we've focused on developing a new model of school-based services for 2021. We've been working with Gilchrist and Baker County to expand our ability to serve indigent care while continuing to preserve Medicaid funding so that we can really stretch both the public dollars and the private dollars as far as possible to meet the needs of as many children as possible in the schools. This really is a key initiative for Meridian. We see a lot of kids that are home in need of services, but not necessarily able to get them. So through some of these new and innovative models, including virtual, we've gone on and we will continue to re-innovate care. And part of our treatment goal is always to do what's best by our clients. We are working to eliminate the use of benzodiazepines and stimulants for adults in support of newer, safer, less addictive medications and protocols. Many of these medications have been out there for a long time. They get better and better. We need to change with the times, and really we need to work in a way that's more innovative and has less impact for medical conditions for our folks long term. There are a lot of new options out there for medication. Not only are we eliminating benzodiazepines and stimulants for adults when possible, we're also looking at long-acting injectables. They really are a game changer for a lot of the folks we serve. We work with many of the insurance plans, both for 30-day and 90-day long-acting injectables. We're also involved in a lot of clinical trials, really that make a difference in folks' lives. Being a leader in behavioral health, it's really critical that we look at some of these new and innovative methods to really grow the care that we provide and really be at the forefront of meeting the needs for our communities. So as you can see, 2020 was by no means a year that we pulled back. It was a year of change. It was a year of disruption. It was a year where we were able to continue to grow because we were prepared to grow. We were prepared to grow and meet the needs of our community. And that's essential if Meridian is going to be in our community for a long time. Being part of the community is who we are and what we are, and we always need to strive to innovate and grow, both in the service delivery and the options we provide to the folks we serve. It's been a bit of a change and a shift. Dr. Labarda, who is at the helm of Meridian for 19 years and really set us up for where we're at and where we continue to move forward, had done an amazing job in the CEO role. We have a board that is extremely dedicated to the work we do. And I just want to highlight two folks from the board. The first one is Rosalind Slater, who served on our board from 1994 to this year. Roz passed away. Roz was an amazing person. She was someone that cared about our clients, about the folks we served, in a passionate way that just cannot be forgotten. And I just want us all to remember Roz as the special person she was and what she's done. And the second person I want to mention is our outgoing board chair, Deb Gordon. She served as our board chair for 2 years. She had her own personal challenges. She always put Meridian first. And I can't thank her enough or be more grateful for what she's done for Meridian. And I'm just excited that she's going to be with us and be on our board for years to come. She's a very special person. And I just can't say enough about the work that she's done over the last 2 years. Deb, normally we're together, and I have the ability to hand you flowers on behalf of the board and the staff, and thank you for your service as chair. We can't do that because of this virtual event, but we're going to make sure that flowers are delivered to you, and we just want to say thank you so much for all you've done as board chair and all you will do on Meridian's board for the years to come. You've been amazing, and thank you so much. So as you can see, we have a lot to celebrate, we have a lot to be proud of, but there's much more work to do. Thank you all for your support through the year, and we look forward to continuing to work with you in the future.
Hannah is suffering from depression. She feels worthless, has a loss of appetite, and experiences suicidal thoughts.
Hannah, it's time to eat.
I'm not hungry.
Our telehealth services help you to improve your mental health and take control of your life in the comfort of your own home. We are ready when you are.
And now we'd like to transition into our awards. The Hope Recovery Wellness Community Awards are presented to the community organizers or individuals that continually support Meridian's commitment to enhancing hope, recovery, and wellness in the lives of those we serve.
The first award to present is to Robert Hutchinson. Working with him this year has just been amazing. His commitment and dedication, both personally and professionally, is bar none.
He is a longtime Alachua County Commissioner and relentless advocate for the community, and mental health is no exception. Hutch is often seen declaring May Mental Health Month and identifying opportunities to support the treatment of mental illnesses. Commissioner Hutchinson supported the development of reduction efforts in jails for those with behavioral health issues, creation of a strategic plan to address these issues. He is a vocal advocate in the Commission of Meridian's effort and funding, and is a vocal initiator of mental health first aid. He was also the first to raise the idea of training all county staff in mental health first aid. Hutch was part of the Criminal Justice, Mental Health, and Substance Abuse Program Initiative Advisory Committee. I know that's a mouthful. The program has led to significant benefits for many county citizens served, enabling them to successfully address challenging behavioral health needs and pursue personal recovery goals. The primary goal of this program is to divert adults with a history of criminal justice involvement that are at risk for recidivism and divert them to treatment and community service. We are filled with gratitude for all of the way that Hutch has made an impact on mental health. The reach is broad and deep. Thank you, Commissioner Hutchinson.
Thank you. I'm accepting this on behalf of all the peers at Meridian and in our hospitals, and especially at Gainesville Peer Respite, the first such facility in Florida. And on behalf of Alachua County, the first local government in the nation to have 100% of our employees trained in mental health first aid, in classes largely taught by Meridian. And to our local law enforcement and judicial leaders who finally heard our message that drug users should not be incarcerated. Today, the number of inmates in our jail for simple cannabis possession is essentially zero, a 99% reduction from just 8 years ago, and despite virtually no relief coming from state or federal reforms. And to our nonprofit community, groups like NAMI, the Gainesville Opportunity Center, Peaceful Paths, Gainesville Peer Respite, the River Phoenix Center, and so many others who transform trauma into recovery. I'm particularly proud of the Community Foundation and their donors for their emphasis on funding community mental health partnerships. And thank you to my mentors, Maggie Labarda, Denise Ferrero, Sadie Darnell, Terry Mullen, Judy Broward, Jackie Davis, Leah Compton, Rosella Papa, and to Meg and Marilyn, and so many others. To you, I owe what sanity I have maintained in these crazy times. Mental health is so much more difficult to hold on to in our complicated, traumatizing, socially fraught era. But as a community, we have come incredibly far in finding ways to advance the cause of mental health. I know that with the partnerships Meridian is so good at building, we will continue to make progress in supporting one another in mind, body, and spirit. Cheers.
Our next Hope Recovery and Wellness Award goes to Sheriff Sadie Darnell. She's the outgoing Alachua County Sheriff. Her partnership and commitment has just been amazing. She cares about those that suffering from mental illness and substance use disorder. She's pioneered so many things in the Alachua County Sheriff's Office related to the needs of those with mental health and substance use disorder. She continues to be a longtime supporter and key individual that's really made a change in the way that law enforcement and really as our community at whole thinks about the folks with mental illness and substance use disorder.
She was recently a key law enforcement individual in the mobilization of the co-responder program in Alachua County, which was launched in June of 2020. This co-responder team pairs a law enforcement officer with a Meridian clinician. The team rides in a marked sheriff's cruiser and responds to calls involving persons with mental health illnesses, mental health crisis, and other emotionally charged situations, all the while building positive relationships within the county. The results have been impressive, to say the least. During the first 3 months of operation, we've already seen impressive outputs and outcomes. We've had 167 calls for service. 80% of the individuals who could have been held under the Baker Act were diverted to outpatient services or voluntary inpatient treatment. 100% of the people who could have been arrested were diverted into treatment. In short, the mental health team was able to divert individuals contacted who would have been Baker acted or arrested to a more effective and less costly treatment. As with all outstanding community programs, there has to be incredible people and/or organizations in the background making the launch of the program look effortless. This story does not break the mold. Thank you, LSF, Health Systems, and the Department of Children for sponsoring this program. Sheriff Darnell's mental health advocacy story doesn't begin or end with the co-responder team. I can't tell you how many videos the sheriff has appeared in on behalf of Meridian. When she speaks on the topic, it is always personal and passionate. She shares freely her commitment to helping those affected with mental health illnesses in the community. We now want to share our gratitude for your work in helping make this community a healthier place. Thank you, Sheriff Darnell.
I'm Sadie Darnell, Sheriff of Alachua County, and I'm here to thank you. Meridian members, please accept my gratitude to former Meridian leadership Dr. Maggie Labarda and to current leadership CEO Don Savoy regarding my selection for the Hope, Recovery, and Wellness Award. It means so much to me, and especially for those of you all who've been around for a couple of decades, you know that mental health has always been not only professionally a priority of mine, but also personally. My family has struggled with mental illness. My mom suffered from chronic clinical depression. I tell the story openly that she was Baker acted several times at just about every hospital here in Alachua County. She had the ability to have good responsive treatment, but even with that, she attempted suicide and was in a coma for 3 days. She was the recipient of just the type of hope and recovery that this award represents. She lived to be 92. She was happy, healthy, and in a very, very good place because of the treatment and the support that she received over the years. And then, of course, in law enforcement for over 42 years, I've seen my share of the needs in not only Alachua County, but also in the surrounding counties for the type of responsive, compassionate, knowledgeable care that Meridian Behavioral represents. It is indeed my pleasure. I'm humbled by the recognition. It means so much to me, as I've said, from a personal and professional standpoint. And I'm going to add one thing, because the statute of limitations is over for a period of probably multiple decades. But as a young police officer back in the late 70s or early 1980s, I remember patrolling the streets of Gainesville during the winter. It was horribly cold, and we as Floridians don't tolerate the cold anyway very well, but it was horribly cold, and I came across a man who was homeless, and he was out. He had a long sleeve shirt on and a light jacket, but he was miserably cold. And I said, "You don't need to be staying out in this weather like this." He says, "Well, I've got no place to go." And so I thought for a minute, and I said, "Well, can you act drunk?" And he said, "Yeah, I can act drunk." I said, "Well, I'm gonna have to handcuff you and put you in the back of my car, but I've got a place I can take you." So sure enough, he got in the back of the car, and as we were driving to the Bridge House at the time, which offers the Marchman services, I said, "Now be sure, you gotta act drunk going in there, and you'll have a warm place to stay for the night." Well, sure enough, he pulled it off like a champ and acted drunk, wasn't belligerent, but he was acting drunk enough that he was accepted, and he had a warm place to stay for the night. I tell you the story because that was close to 40 some odd years ago. And we still have a problem with homeless. We still have a problem with individuals in our communities who are suffering from a mental illness, and they need our support. So I encourage you to do what you're doing. Continue the great work that many others, Dr. Labarda and many others, have done. And for those of you all who are coming behind her and behind me, continue the very purposeful work that means so much to so many. Thank you.
Our third Hope, Recovery, and Wellness Award goes to Ken and Denise Bennett. Ken and Denise were essential benefactors for the renovation and creation of our Children's Center in Lake City. They really understand the mission and the need and really give of their hearts for the folks we serve.
Additionally, Ken and Denise were compelled to provide the gift that launched Meridian's tablet program during the initial phase of the pandemic shutdown. At the time, many children were not able to participate in their regular therapy sessions at school, and many adults didn't have adequate resources to participate in telehealth. When Denise and Ken heard us speak about the lack of resources for some of our clients, they jumped right in. Virtually skipping the part about being asked for the gift, they offered to fund the launch of this project. Denise has served on Meridian's Board of Associates for the past 2 years, which she now chairs as board liaison. She subsequently became a member of the board of directors this year. Ken and Denise are committed to the community and have an incredibly strong affinity for mental health. We are grateful that you continuously partner with Meridian and help to move the needle on care. Thank you, Ken and Denise. Our last Hope, Recovery, and Wellness Award goes to 2 employees from the Suwannee County School District. These 2 advocates for children really went out of their way this year to help support children and help Meridian continue to provide vital mental health care for children in their district. Deborah Land, Director of Student Services, and Kelly Waters, ESE Coordinator, worked closely with Meridian during the COVID to support students and families struggling with mental health and substance abuse issues. Deborah and Kelly were instrumental in securing funding from the board to continue mental health care for their students with no insurance or that had prohibitive insurance deductibles. This ensures clinicians could continue to see students that needed essential care. They both worked side by side with Meridian staff on a regular basis and were always open to new and innovative ideas to improve mental health care at their school in Suwannee County. During COVID, they provided information about Meridian services and how to access care to the families through printed material and online platforms. They also provided informational flyers to families when they delivered homework and/or delivered food to students' homes. We are grateful to Deborah Land and Kelly Waters for modeling best practices in supporting community-based mental health to students in the face of uncertainty.
Hello, my name is Bill Guptill, Chief Operations Officer with Genoa Healthcare. I wanted to extend my appreciation to all of you at Meridian for the long-standing partnership that we've had together. The commitment that you've made to the local communities in Florida has really been remarkable. During this time, now more than ever, our ability to provide access to mental health services is so needed in the communities that we're part of. I'm happy to be a sponsor of Meridian, and I look forward to continuing to work with you and the great people that you have in your organization for years to come. During these times, the commitments of all of our employees, the commitments of the local communities and the partnerships that we have will carry us through, and together we'll be stronger than ever before. So thank you again for your partnership, and thank you for your commitment to the communities. And we look forward to being a part of your partnership in your local communities for years to come. Thank you.
Don, you've been talking about the dedication of your employees and their commitment during this pandemic for some time. Would you share with all of us what they've been doing?
Sure, Jeff, I'd be glad to. It's really been amazing. We didn't think we'd be sitting here wearing masks, but it's what it takes to keep people safe. Our staff have really stood up and really gone above and beyond. I can give you examples where staff have been sleeping in their cars so that they were available to take care of clients. We have folks that have had family members take care of their kids, their elderly and their families, so that they could come in and do their job. We've not had an outbreak within the staff or the clients of any significance, and we've really been able to keep all our offices open and really take care of the folks that need us in our community. This has been an opportunity for Meridian to show who we are in our community and really to make a difference.
You were telling me earlier about your annual employee awards and that you were changing that focus this year. Just how are you changing the focus this year?
Well, thanks for asking, Jeff. Normally we recognize some key staff with Employee of the Year and several other innovation awards and things like that. This year is different. It's one like we've never seen. And really, everyone has been exemplary. They all are healthcare heroes. So the board this year and the executive team decided that it's important that we recognize all these staff as exemplary and as really leaders in the community as healthcare providers. We are essential services, and these folks have done an unbelievable job to take care of the folks from their community. So we're excited to recognize everyone who works at Meridian as healthcare heroes, as leaders in the community, and as folks that truly care and make a difference. Without them, Meridian would be nothing, and they've just really stood up and done an amazing job. They've done it in ways that sometimes it's hard to talk about. They've stayed away from their families for long periods of time while they've cared for folks in residential treatment. We've had folks through this entire pandemic that have gone out in the community when folks were in need and in crisis. What more can you ask of folks? It really is they're amazing people. And, leading Meridian for my first year, to really understand who our staff are and their dedication and commitment to the folks we serve, it's heartwarming. It's something that I never thought it would touch me the way it has, but it's absolutely amazing.
Meridian covers North Central Florida, so I know you have a lot of employees, a lot of heroes. How do we know who they are?
Well, we do have a lot of employees. We have about 750 employees. They are all healthcare heroes. And you don't always know who they are. They are just like the rest of us. They're members of the community. But they are part of Meridian. I am Meridian is not just a statement. It truly is from the heart for the folks that work here. Their dedication and commitment is absolutely amazing. As we wrap up this edition of 42 Minutes, you'll see their names come up as credits. And if you run into any of them and you know them, please say thank you for their exemplary work, their dedication to the folks we serve, and really for saving lives as they continue to do so through this pandemic.
Don, thank you so much for sharing all of that with us. It is clear that you really care for and believe in your employees. I can't wait to see the names of all of our healthcare heroes in the closing credits. And now back to our board chair, Deborah Gordon.
With no further business to conduct, the annual meeting is adjourned. Jeff, thank you for being our anchor. Don, I want to thank you for your leadership, and I especially want to thank the award recipients and all of Meridian Healthcare Heroes. Thank you for joining us, and don't forget to stay tuned and view the names of our Meridian's Healthcare Heroes. This meeting is now adjourned. I can't do it. I'm going to do it again. I'm just going to do the meeting is now adjourned. How about that? I'm looking at your hands. It feels so weird just to stare at that thing.
Health issues. Totally changed that around.
Yeah, I was like, what just happened?